DNNs, I just wanted to do a little bit of a video, kind of tell you what's going on, what's new in the industry, what's new with DNN. So today I'm at the Advanced Impression Taking course. I absolutely love this course, and a big reason is because when I was nursing I couldn't do all these things, so I absolutely love that nurses can increase their scope of practice. They can take alginate and silicone impressions, so rather than the dentist take all the impressions for like short-term orthodontics, let's say Invisalign, 6-month smile and Inmin, just to name a few, rather than the dentist take them, the nurse can actually take them, and it just gives you more responsibility, it's more skills, you're learning how to work with new products. So I think it's just absolutely fantastic. The nurses absolutely love it. I always see them enjoying themselves whenever they're on these courses. So I'm really pleased to be a part of this and kind of bringing this out into industry. I don't really think there's anyone else. I know maybe one company, but no more than that are offering at this kind of advanced level, so the silicone impressions. Most other people are doing sort of alginate, which is good, but it's kind of good to work with both the main products that you use in dentistry. So that's the advanced today, and then I've also taken some videos so you can see actually what goes on in the courses. And the next course I've got coming up is the Introduction to Practice Management for Dental Nurses. Now what that is kind of explaining how you go from being a dental nurse to a practice manager, so what the steps you need to take. Fliss, a wonderful teacher, is a multi-site practice manager, and she's also a coach as well. Now she is going to be going over 10 main steps, and she'll also be coaching you all onto to create a good sort of career plan to get yourself to where you want to go to. So that's that course, and then we've got the treatment coordination one coming up in August. That's in Manchester. We've already run a few this year and they've been absolutely fantastic. So yeah, if you haven't booked on, do book on, because we don't have that many spaces left anyway. But apart from that, it's been a fantastic year. Thank you so much for all your support. Thank you for making this all possible. It's the first year that I've gone nationwide with courses, and it's been absolutely brilliant. And I'm so glad to be offering all these courses to the whole of the UK. Hopefully the bigger we get, the more we can go into even the smaller areas, just to allow more options for you nurses really. I really feel that the profile of dental nurses is really rising in this country, and I'm really excited to see what's going to be happening in the next few years. Stay tuned.
It's just one of the reasons.
So overfill your scoop. Chop, chop, chop.
Yeah.
That way you have an even scoop.
Yeah, that's it.
Yeah.
Natural is doing this.
Again, uneven mixing will affect your impression. So here's the going in. Posterior seated first. Go as far back as you can with the teeth still remaining central and the handle positioned around the midline. Nice bone pressure up. Maintain the pressure. And this is where you get messy, releasing the soft tissues with a separation wafer over the top. Okay? And we go. So, as I say, suitable amount of pressure unfortunately is needed. You do feel a little bit of a bully at the moment, I'm afraid. So again, making sure you centre with the midline, centre teeth in the trough. Get yourself all lined up, and then it is quite literally support the patient's head. Well done. Reassure the patient all the way throughout. This bounces back.
Yeah.
It really bounces back, so get your fingers in for support. Well done, Mars. And just release your soft tissues and relax a little bit. Well done. Okay, so we've got a nice, deep, special tray. Okay, feel that out. We've got a nice reflection of the dental arch. Okay, no fine detail, just enough to say to capture that.
Rachel then filled the material with the virtual wash as supplied by Ivoclar, and that allowed her to get a more detailed impression. So the putty, the first part of the impression gave a sort of special tray, then this part of the impression allowed her to get all the detail of the teeth, including all the surrounding margins. These impressions are what's needed for Invisalign, 6-month smile, and Invisalign, or the short-term orthodontic